Thank you, Chairman Carter. Before the invocation, I just wanted to share something. I started out my morning in the chapel, which is beautiful if you've never been in there. And I was kind of feeling overwhelmed, maybe much as many of you. 3 hurricanes in a row, Mexico City, Las Vegas, California being on fire. And I was praying for all those things, but it seems like even though you want to help, you can't help in every circumstance. And I believe the good Lord gave me a reminder in the note from a small boy that is actually addressed to the hospital that I found in the chapel this morning, right when I needed it. Just a reminder of who we are and what we're doing right now, right here at this board meeting, and when we leave here out on the floors, just a reminder of how we're making a difference right here, while we may not be able to make a difference everywhere. This is a note from a little boy named Robbie. It's got a heart on the back. It's got a kite on the front that says, "You're going to be okay." And this is what it says. Dear hospital, I hope all of your patients get well, and always let God be with them. Thank you all for all you have done. Please be helping the best you can. Please free all their sicknesses. I think you are very nice for helping everybody. From Robbie. May we pray. Gracious God in heaven, in a world filled with more heartaches than we can personally address, we thank you for the simple privilege of caring for our neighbors in need. And we're grateful today for the reminder from a little boy named Robbie, and we echo his thoughts as we pray. Grant us the compassion to be helping the best we can, and grant us wisdom with our patients so that we can free all their sicknesses. We hope and pray for all of our patients to get well, and always let God be with them. These things together, we pray. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I want to call to order the meeting of the Sarasota County Public Hospital Board, and I'll start with a public comment. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted to the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Our first item on the agenda is the approval of the orders of the day. Do I have a motion? Second. A motion and a second. If there are no comments or questions, all those in favor of approval of the orders, please indicate by saying yes. Yes. Opposed? Motion passes. Thank you. And the second is approval of the minutes of our meeting from September 18th. We have a motion and a second. Any comments? Seeing none, the minutes are approved also. Thank you very much. I don't think we have any board reports, so we'll start with our presentation today, and it is my honor and my privilege to introduce our speaker, who has had a long career at Sarasota Memorial Hospital in OB, GYN, and maternal fetal medicine, practicing in Sarasota for 25 years. He is the founding director of Sarasota Memorial's maternal fetal medicine program, a position he held for 8 years. He's the past chief of medical staff, chairman of the Department of Obstetrics and Gynecology, and medical director of labor and delivery at Sarasota Memorial Hospital. In 2012, he received the SMH Lifetime Achievement Award. Today, he is involved daily in the care of high-risk obstetrical patients at SMH, the Florida Department of Health, Sarasota, perinatal education, community advocacy, and involvement in education. And it is really a pleasure to introduce Dr. Washington Hill.
Gee, Mr. Carter, thank you very much. I think most of you I know, Carol Ann, Mr. Carter, and hi, David. I was asked to talk a few minutes about a program that several of us here at the hospital have put together. You see the title, Addiction Support in Pregnancy, and then one of us, Dr. Hedstrom, came up with the acronym of ASAP. Dr. Hedstrom cannot be here today because of obligations in the office. Just a few slides. This is our data, and first of all, I must acknowledge our pharmacy. The NICU has a satellite pharmacy, and you can get any data that you need from them in regards to this issue or other issues, even if you ask them 24 hours ahead of time. And this is the data that was put together for me by Kathy Wimbush, who is a pharmacist in that unit. And you can see very clearly from April the 1st, 2008 to March the 31st of 2017, which is the latest period of time that we have the data, that there has been an increase in the number of babies monitored for NAS. NAS is neonatal abstinence syndrome, and that would be babies that were exposed to some opioid during the pregnancy. And then the middle column tells you the number of babies who've been treated. All of the babies who have been exposed do not have to be treated, and that's because of many things, but some of those are what we are doing in the NICU, so they won't need to be treated with medication, and currently that medication is morphine. So you can see that both of those, there's been an increase in the number of babies monitored, and in the ones treated, it's starting to stabilize out. And again, that may be because of other things that are going on in the nursery. And then you can see the average length of stay. If you look at an average baby of a mother who comes into our institution, that's average length of stay is about 2 days, 3 days at the most if they've had a cesarean delivery. And you can see on the column on the far right that in these babies, that average length of stay can be as long as 13 days and even longer. There are babies who go to pediatrics who are there for a month, and that equates to money. And one of these days, we'll try to get data on what the average cost is for those babies. But you can see if a baby is here for 13 days or up to a month, in some cases, that's the average, that it would be significant. So three of us had a question, and the three of us are Dr. Hedstrom and Pam Beitlich, who's bashful and sitting in the back. And we asked the question, can we safely do something different for healthier moms and babies? We knew what the problem was, and actually a patient came to me who was on methadone. She was on about 20 milligrams and said, Dr. Hill, I'd like to come off of my medication so that my baby won't be one of those that I just showed you. And there was no way that we could do that. And there was no program or where we could do it. We actually, and Pam remembers this, had invited the folks who supply methadone to come visit with us in the auditorium about, 3-4 years ago? And it wasn't a very nice session. I remember getting up and saying, folks, we've invited these people here, and we were kind of rude to them, and they didn't want to come back. But the problem was that the NICU nurses were very upset about the NAS babies. So the three of us have gathered together various partners in the community, and the goal was to ask anyone who had a need to see these patients or who touch these patients to get together. And this is a group that we have put together since April or May. You can read the list, and it's in your slides. And what this group does is to meet monthly. We actually meet a week from today. And we sit down and come up with a plan or teach one another. I'll give you an idea. You see there, says the Sarasota County Jail. Pam remembers that we had an instance where a patient was on methadone and pregnant and released from jail on a Saturday. Well, gee, that really created a problem because there was no place for her to get her methadone. She ended up coming here, being admitted, getting it through our pharmacy. So now we have worked out a mechanism where that happens. You can see all the other groups that we have had come together. And these are the services that I think the group has provided. It's not the end of them, but certainly now I think we can certainly say that we have had judgment-free collaborative care. There's a peer support group meeting that's here at the hospital. We work with the medication-assisted services. There's 2 of them here in Sarasota, and a host of physicians who provide them as well. There's an excellent team of providers and clinicians. Of course, we have our level 3 NICU, and then we have breastfeeding education. So this is just a start of the many services that we provide for this community, and keeping in mind that this is a community hospital. This is the brochure, and I certainly could not have done this without Peter, who's also bashful, sitting in the back. I went to Peter and I said, you know, we need a brochure. And he said, of course, for what? And I told him, and he assigned someone to me, and this is the brochure that we have come up with. This is one side of it, and I think you have it in front of you. It's very nicely done, and the goal is to get this brochure out in Sarasota, wherever there are patients who are addicted and pregnant. There's a bunch of them in the back of my car, so when I go to the barbershop or go someplace in the community, I just leave some there, as does Dr. Hedstrom. And then we develop a support group. This is actually led by Dr. Hedstrom, and it's on Thursday night over in the conference room for L&D. And then we developed a tour, because one of the problems is that these patients need to know what's going to go on in the hospital. Some of them fear that when they come to the hospital, we're going to take their baby, which is not true. So we give them an opportunity to tour labor and delivery, a tour pediatrics, and a tour the NICU. So those are 3 solid things that we've been able to do. So finally, what are the next steps? I put on the left side the short term, what we've been trying to do, and much of this we've accomplished: improve collaboration and communication between the providers, those who provide the services, involve First Step. First Step is a residential program of which we need more in this community. Healthy Start, and all the agencies that touch these patients and their children, encourage the patients to visit the L&D and NICU and PEDS and the support group. And then the last bullet is something that we're going to work on, and that is with the drug court. There's a drug court system here, and I was talking with Judge Owens and Judge Williams. We may be able to get these patients who are pregnant into a diversion program where if they keep their prenatal appointments, they come to the tour, they come to the support group, we may be able to shorten some of the days they have to be in jail. And then the long term, which got us started on this, is to develop somehow a program where we can get some of the patients who are the right patients and want to be off of their medication during pregnancy, off their medication. We're still working on that goal. Any questions? Pam, do you want to add anything? Seriously? Okay. Any questions, comments? We could not have done this without the support of this hospital, whether it's marketing, whether it's Pam's secretary, whether it's Pam, all of those things, and some I'm sure that I've left out, we've been able to get through the hospital. So thank you very much for your support.
Thank you very much, Dr. Hill and your team. Our next item is we'll start with the Excel Award. David?
Thank you, Mr. Chairman. I would like to invite our October 2017 Excel Award winner up, Johanna Krimpel. Johanna. Congratulations. Thank you. Again. I told you I was going to do this to you, right? Yeah, go. Go. Johanna Krimpel is our October Excel Award winner. She is an RN in labor and delivery and has worked at Sarasota Memorial since 1984. 33 years for those of you who are math challenged out there. Johanna's coworkers all agree she is an experienced charge nurse who multitasks like no other. One of the quotes is, she runs our unit with great efficiency and safety, says her coworkers, and with a high standard and excellence every day. Labor and delivery is a busy place where Johanna's coworkers say her outstanding communication skills truly shine. They describe her as having a higher level of situational awareness with physicians and nurses that is needed, especially in emergencies. Johanna is a professional, accountable, and always present, her coworkers say. Most of all, they summarize, she is genuine. She is true to herself, her patients, and knows who she works with. You can always count on her. Thank you so much for everything you've done.
Thank you very much.
Thank you. Mr. Carter's going to come up and read the plaque to you.
Okay. Thank you.
Congratulations.
Thank you very much.
The Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes you, Johanna, with the Excel Award for the month of October 2017. Thank you for your continued dedication to excellence. And it's signed by our President and CEO, David Verinder, and myself as Chair of the Board. Congratulations.
Thank you very much. Well, I started here under Mr. Floyd, so I've seen a lot of people come and go, and I always felt that the hospital was supporting my colleague and myself in what we do, and we couldn't do what we're doing without the support of everybody. So I want to say thank you for making it possible for us to do the job we do. Thank you very much.
Mr. Chairman, may I keep going? We also have a Hero Award to recognize today. So I'd like to ask Pam Ashby to come join me. Pam? Told you I was going to do this to you, right?
Yes, you did.
Okay, all right.
Man of your word.
She's not very happy with me right now. Yes, ma'am. Pam Ashby is our Hero Award recipient in October. She is clinical manager in neurology and urology. Heading to work on US 41 on an early, dark morning. I know I commented about that before, but it does sound like a horror story setting up. Pam came upon a downed bicycle and rider in the road. A delivery truck had stopped at the scene, and Pam did as well. She assessed that this was a female bicycle crash victim with significant facial injuries. It was likely she had other injuries as well. Pam found a pulse and asked the other bystander to call 911. At this point, the victim was minimally responsive, so Pam kept her still, calm, and comforted until EMS arrived. Thank you, Pam, for everything you did for our patient. Thank you. Mr. Carter?
Congratulations.
Thank you.
The Hero Hall of Fame. The hospital board and administrative staff of Sarasota Memorial Healthcare System hereby induct you, Pam, into the Team SMH Hero Hall of Fame. for actions that capture the essence of a true hero, including courage to have persistency in the face of fear, passion to always do the right thing, integrity to have a strong moral compass, and concern to have concern for the well-being of others. And this is signed by our President and CEO, David Verinder, and myself as Chair of the Board. Thank you very much and congratulations.
Thank you very much. It was a dark morning because it was 6 o'clock in the morning on US 41, so that's why it was dark. But I'm really not a hero. I will say I've been here 33 years as well, and the culture of this organization is one that the people really do care about this hospital and the community, and anyone else I would be willing to say would have done the exact same thing. But it's also because it's a part of this culture that I feel like I've grown up in, so thank you very much.
The next item is the report of the medical staff. Scott Stevens, Chief of Staff.
Thank you. I present a recommendation from medical staff to approve a new OBGYN privileging form for your approval.
Alrighty, and I'll make a motion in that regard. I move approval of the OB-GYN privilege form as recommended by the Medical Executive Committee.
We have a motion and a second. Any questions, comments? Seeing none, all those in favor of the motion, please indicate by saying yes. Yes. Those opposed? Motion passes. Thank you very much.
I would just like to also say this is my last meeting as Chief of Staff, and it has been an honor and privilege to work with the board and the administration in producing a tremendous product. This hospital has everything to be proud of as it serves our community so well. Thank you.
Thank you, Dr. Stevens. Go ahead, David.
So, Dr. Stevens, I just like on behalf of the hospital, thank you for all the time, energy, and effort you've put in because it's been tremendous. Very much enjoyed working with you for this past year. I look forward to continuing to work with you in your new past Chief of Staff role. And we just want to thank you wholeheartedly for everything you've done. Thank you.
Next is the foundation report from Mason Ayers.
Thanks, Mr. Chairman. Last Thursday night, we kicked off the social season here in Sarasota with the Foundation's 12th annual Key to the Cure event. We had a great turnout, nearly 1,000 attendees for the evening. I'm happy to report that the event looks like it's going to raise over $200,000 for the SMH Women Cancer Program. Big thanks goes out to Saks for being such a wonderful host. Also the foundation team, especially Sally Schul and Rachel Williamson. Also the SMH team for being there. And many of you here in the room today, we appreciate you coming and being part of the Key to the Cure event. Also just wanted to let everyone know that our next big event is going to happen in January. It's the Hospital Gala. The proceeds from that event on January 13th at the Ritz-Carlton are going to go to the SMH Emergency Services Program, especially the trauma program. If you're interested in attending, I would suggest to get your seats or tickets in quickly. We are projecting to have a sellout. So that concludes my report, Mr. Chair.
Thank you very much, Mason. Tram Hudson's not here today, so Carol Ann Kalish will give our secretary's report.
So Mr. Hudson finds himself in North Carolina and unable to attend, so I will give the board calendar report. Monday, November 20th, 2017 is actually the board's annual meeting, and on that day from 9 to 10:30, the Governance Effectiveness Committee will meet. From 10:30 to noon, the Finance Committee will meet. From noon to 12:30 will be a closed session of the board for peer review. From 12:30 to 2 will be the board lunch and financial review, and then from 2 to 4, the board meeting. That's my report for Mr. Hudson.
Thank you, Caroline. Next, we have the treasurer's report. Jim Meister.
Thank you, Mr. Chairman. I move approval of the bad debts and charity care for the month ended September 30th, 2017 in the amount of $17,337,000.
We have a motion and a second. Are there any discussion, questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you very much. Now we have our financial highlights from Chief Financial Officer, Bill Waldron.
Thank you, Mr. Chairman. I have the financial highlights for September. With this being the last month of our fiscal year, we do keep the financial books open a little bit longer in preparation for the arrival of our external auditors. And as such, I don't have financial highlights, but I do have the statistical highlights for the month. And we'll start out with, for the hospital, the average daily occupancy these are year-to-date numbers, an average of 486 this fiscal year compared to a budget of 488. The average acute length of stay in fiscal 17 was 4.52 days compared to 4.61 days last fiscal year. The hospital's admissions for the fiscal year, 33,262 compared to a budget of 31,302. The hospital had 22,195 surgery cases in fiscal 2017 compared to a budget of 22,071. And births, we had 3,519 compared to a budget of 3,547. Looking at our outpatient registrations, they totaled 428,402 for the fiscal year, compared to a budget of 441,470. And registrations between our two emergency care centers totaled 122,654, compared to a budget of 127,456. Mr. Chairman, that concludes my report.
Thank you very much, Bill. We'll move to committee reports and start with the Quality Committee. Joe DiVirgilio, Chairman.
Thank you. Since the Quality Committee meets in closed session, I do not have a report on the committee actions. However, we do have one item that needs board approval, and I move approval of policy 01.PAT.14. It's organ and tissue donor procedure as recommended by the Quality Committee.
We have a motion and a second. Do we have questions, comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. Next, we have the Audit Committee report. Carol Ann?
Mr. Henry, do you want me just to go ahead and read the motions?
Read ahead, Carolyn.
Okay, sure. As a courtesy to Mr. Henry, because there was a little confusion about the draft of the motions, I'm going to go ahead and make the motions that were made and the recommendations made to the board from the Audit Committee this morning. The first is a recommendation to approve the proposed changes to the Audit Services Department Charter. And so I would ask that a board member move approval of the amendments to the Audit Services Department Charter as recommended by the Audit Committee.
We have a motion and a second. Are there discussions or questions? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
Terrific. The next one is the approval of the annual audit plan, and I would just ask that a board member make the motion to approve the annual audit plan for the 2017-2018 year as recommended by the Audit Committee.
We have a motion and a second. Any questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes. Yes. Opposed? Motion passes. Thank you. That's it. Mr. Henry, do you have any comments?
Thank you, Carolyn, very much for filling in for me.
My pleasure.
Okay. Now we have the President's report. Our President and CEO, David Verner.
Thank you, Mr. Chairman. Let's start today. First off, this is our September fiscal year to date, 2017 organizational report card, which happens to be the last month of our fiscal year. So these are the cumulative results for the entire year I'm about to present. So I'm going to start, as we always do, in our service pillar and look at our HCAHPS data. We have had a goal all year of being 8 out of 11 of the number of domains at or greater than the 50th percentile on inpatient. Happy to report that we did hit our goal at 8 out of 11 for the year. On the outpatient side, we had our goal of hitting 55 out of 58 of the domains, outpatient domains at a greater than 50th percentile. And I'm happy to report we actually exceeded that and hit 57 out of 58 for the year. In the people pillar, we had a goal of having our turnover of part-time, full-time employees within 12 months of their hire date being at a turnover rate of 25% or less, and this is when it was something we struggled with all year. I'm happy to report we came in just under that at the end of the year at 24.9%. In the quality pillar, we had our goal of being in infection prevention, which is the combined overall standardized infection rate. Our goal was being less than 0.95. Given that the expected rate on that from CMS or the nation is 1.0, we came in actually considerably less than the 0.95 at 0.89. And so thank you to all the clinical staff and hospital staff that made that happen. Dr. Stevens, thanks to the medical staff for certainly their huge role in that. In the finance pillar, I would usually say we've already heard this from our chief financial officer, but since he did not report to finances today, I will show you our organizational finance operating margin had a goal of being our 5.1%, which was our budget. And as he has indicated on this sheet, we are expecting an 11.5% operating margin, which, as he's indicating, says unaudited. In their way, they won't commit to that until our audit comes out, but pretty sure that's good. Right, Bill? Okay. In our growth pillar, we have our strategic growth organizational goals, our inpatient admits and observation patients. We have a goal of being 38,899. We did exceed that. We're at 42,202. And our outpatient registration goal at 799,000, we did come in short of that and hit 776,100. So when we take a little bit of a deeper dive into our HCAHPS scores, I reported that we were at 8 out of 11. You can see the 11 domains there on your left. And then you see what our score was in the green and red column there in the middle. So the green obviously are ones that we hit or exceeded the 50th percentile. Red are where we fell a little bit short. And I just wanted to thank our clinical staff for really going above and beyond on this. They spend an inordinate amount of time working on this and making sure we hit our expectations to our patients. So thanks to all of them. Moving on, looking at our service pillars, we did have a chance to celebrate a number of our teams this past month. We had Rehab Week, September 17th through the 23rd. Environmental Services Week, October 2nd through the 6th, and in our Healthcare Security and Safety Officers Week, October 9th and 13th. Certainly, all of them do an amazing job here and deserve more than 1 week of recognition, but that's what we do. Staying in service, we had our annual Key to the Cure benefit, local cancer, as Mason just reported on. The Sarasota Memorial Healthcare Foundation partnered once again with Saks Fifth Avenue and the Mall at University Town Center to help raise money and awareness for women's cancers. The annual event, Key to the Cure, was held this past Thursday on October 12th and honored cancer survivors. Proceeds benefit Sarasota Memorial's cancer care programs. And I believe, and Mason can correct me, we had over 1,000 people there. Have raised over $1.3 million to date in this great event. So thank you and your team for everything that you do. In the quality category, we had Diane Schwab an RN and our advanced practice program coordinator for acute pain team, was recognized by the American Society for Pain Management Nursing as an advanced practice pain management nurse. It's a lot of words in there. Fewer than 20 nurses nationwide have earned this prestigious achievement. There are strict criteria for eligibility, and a portfolio must be submitted to demonstrate advanced knowledge and competency in the practice of pain management. So I want to congratulate Diane for all of her hard work in this. Staying in quality, First Physicians practices earn highest patient-centered medical home honor. So demonstrating a commitment to provide the highest level of primary care to the community, each of First Physician Group's primary care practices are now certified as Level 3 patient-centered medical homes, the highest accreditation available from the National Committee for Quality Assurance. Research has shown that the medical homes can lead to higher quality, lower cost, and an improved experience for both the patient and the care provider. So congratulations to our physicians there. Also had the opportunity on October 9th to have a columnist, Mike King, write an article supporting public hospitals and talking about the value that public hospitals bring to a community. And just wanted to point this out. Obviously, I'm not going to read this article to you, nor could I if I had to, because I can't read it. But just wanted to thank the Herald Trib for publishing this, and for Mike for taking the time to write it. And I would encourage anyone in the public to go take a look, and I think it summarizes what our organization is about. Staying in people section, or moving to people, I want to announce that we have the Sarasota Memorial named local cancer specialist James Fiorica to serve as the top physician administrator. Dr. Fiorica succeeds Steve Taylor, who retired after 7 years as Chief Medical Officer. As Chief Medical Officer, Dr. Fiorica will serve as the liaison between the hospital administration and the 900-plus members of our medical staff. He will also assume oversight of the health system's quality, population health, and patient safety initiatives. Previously, Dr. Fiorica served as Associate Chief Medical Officer and Chief of Staff. So I know you all know Jim, but please welcome him to the team. Staying in people, Sarasota Memorial recently bid farewell to our longest-serving volunteer, Jane Boakes, who devoted 31 years and more than 16,257 hours to the hospital, the most of any active volunteer. An invaluable leader who started volunteering in 1986, Jane served on the board of the auxiliary, chaired the 200-member Courtyard Tower service, and worked in the auxiliary office. Jane went above and beyond for her country, too, serving as a nurse in World War II. So if you see Jane around town, please give her our thanks. In our growth section, we have a former FSU medical student who returns to Sarasota to help fulfill a community need for OBGYN care. Sarasota Memorial recently welcomed Catherine Gard, MD, physician, OBGYN physician, and former FSU medical student. On September 25th, she returned to First Physicians Group obstetrics and GYN practice, where she completed her OBGYN rotation during medical school 5 years earlier. After earning her medical degree from FSU, Dr. Gard completed her residency in obstetrics and gynecology at George Washington University in Washington, D.C. So please welcome her back to our community. We also have Dr. Jeffrey Humbarger, recently joining First Physicians Group internal medicine practice office at Waldemere Medical Plaza in suite number 405. With over 30 years of experience in internal medicine, Dr. Humbarger provides a full spectrum of adult and geriatric care. After earning his medical degree at the University of Cincinnati, Dr. Humbarger completed his residency at Santa Barbara Cottage Hospital in Santa Barbara, California. As always, we have a number of lectures going on, free lectures. We would invite the community to take a look at our website to see when these are, and we do ask for people to RSVP, although we do offer these as free seminars, and welcome people to come. In our growth area, continuing growth, we also, SMH staffed out in force at the rowing event. Our urgent care and emergency teams staffed the medical village at the World Rowing Championships, which attracted more than 42,000 spectators and 1,500 athletes and delegation members from 71 countries. SMH departments also hosted informational exhibits at specialty-themed expos during the event. And just wanted to call out Dr. Holland, Dr. Gerber for their putting in their team in to run the medical parts of that. And of course, Frank Morgan and Jen Storch for doing the administrative lead. And that is my report, Mr. Chairman. I'd be glad to answer any questions.
No questions for David? Okay. Thank you, David, very
Thank you.
much.
Thank you.
I don't think we have any items on the consent agenda today.
We do not.
Okay. That brings us to public comments, and I think we have a speaker today, Ms. Koch from Sarasota, who has put in a request to address the board today.
And Mrs. Cook, I think you know that you have 5 minutes, and as a courtesy, I will let you know when you've had 3 minutes elapse, and then I'll let you know when 5 minutes have elapsed.
Thank you. I'm pleased to be here. I am a retired registered nurse. I also worked in health policy areas at the federal level for a great part of my career. I want to talk to you today about sick care, not in hospitals, but in your care centers. You all know that you have 6 urgent care centers scattered around Sarasota County. You probably also know that they do not take Medicaid patients. They only take Medicare patients and health insurance patients. If I would go, which I've tried this on a fake area, if I had $150 front end, I could get in to see the physician, and then I would pay for any services beyond the front door. Other than that, most Medicaid eligible people and other low-income residents of Sarasota County don't actually have $150. So where do they go when they're sick? It's not non-urgent care, it's sick care. And as you know, too many of them come into your emergency room. So what are you doing about it? They can't go to the urgent care centers because they're non-affordable. You did open a new center in the Newtown area, which is very nice, $2.2 million program. It's very attractive. It's going to see up to 170 people when it's full, at its full capacity. They will be mostly chronic care people and people who have been being followed post-hospital care. They are not a program for sick people to go to. So they're back to either emergency rooms or deciding how they can get through their current cold or urinary tract infection or whatever that keeps them away from their job and also for their children. I had gone through carefully this community because I've lived here. I've been working on this issue for about 8 years. Some of you may remember I've been in front of the board before and when there was the prior CEO. And so I just raised a couple questions. I actually had a handout that you could see as a thought paper after today, but you don't accept those, which is a surprise to me since I can't give you information that's in front of you. But I ask you 2 questions. With some creative planning, couldn't something happen in Newtown where most of the low-income community people reside, or in the greater Newtown area? It's a nice building, $2.2 million building, a nice building. So
3 minutes
couldn't
have elapsed.
some creative planning go on that perhaps could use nurse practitioners there when the clinic, the medical clinic, the new medical clinic for residents, resident training. You're not fooling anybody when you don't call it anything except training for new residents at the hospital. Your lawyers have said that in the paper. So could not the clinic be open after hours from like 4:30, when your clinic is supposed to close in Newtown, till 9 o'clock on Monday through Friday evenings and Saturdays. They could see people as are seen in the urgent care clinic in other parts of the community that they don't have access to. The functional building is there. The lighting is there. It's good parking. It would be easy for security. So could you consider the possibility that this nice new clinic in Newtown could open 5 to 9 on weekdays and evenings, and Saturdays from perhaps 9 to 5? Possibly, if you think about it, this would not need physician there. You could use nurse practitioners. Nurse practitioners have been working in primary care centers throughout the country I had them in a primary care center in Atlanta, in a poor community 40 years ago. Nurse practitioners working with physicians. And then I would call your attention to, I know you deal with hospitals. There was a study done in 2008 called Crisis in Minority Health, including Newtown Healthcare Access Study. And it determined by...
5 minutes.
Thank you. Are you saying I've already spoken for 5 minutes?
You have.
All right. I would ask permission to tell you this one last study that was done in Newtown in 2008.
Please go ahead.
All right.
One story, yes.
That study that was done identified that the lack of access to health care was the #1 issue for people living in the zip codes of Newtown. The second was sexually transmitted diseases, which you heard a little bit about today. And the third was teenage pregnancies, which you've also established anyway, you're going to work with that area a little bit longer and more fully. 92% of the people, there were 196 people who said out of 2014 that yes, their major problem is in getting health care. You have this new community center there. Could you use it more wisely and creatively for the community where it's located? That's what I ask you to think about today. 2 questions only, and I would be happy to talk to any of you about this. My telephone number, 941-371-5188. I've been, as I said, involved in these issues for over 40 years, so I think I know a bit about what I'm talking about. Thank you.
Thank you, Ms. Cook. Appreciate your presentation. Thank you. Carol Ann, do we have any legal matters?
I have nothing to report.
Any other business to discuss today? Seeing none, we are adjourned. Thank you very much.